My name is Dr. Irfan Atcha, and my office name is called New Teeth Chicago Dental Implants. The services that we provide in our office, so we really have a very few services that we provide because we are literally helping a specific kind of patient. We're providing a very, very specialized, a very, very valuable service for patients that have missing all their teeth, or they have all their teeth that are damaged, broken, and they need fixed permanent teeth to chew their food, to smile, and they don't want to have dentures. They want permanent, fixed, non-removable teeth in their mouth. Say about the last 15 plus years, we are able to perform full mouth implants. Patients can have their bad teeth removed, implants, anywhere between 4 to 6 implants placed per jaw. They can leave with a full set of permanent, fixed, non-removable teeth the same day. To take full mouth implants to another level, we've decided to bring a in-house dental lab in our office. Now, it's called Zircon-Zahn. Zircon-Zahn is a very sophisticated technology that we are now able to design patients' teeth digitally and make their teeth into our CAD/CAM software. And the ability to mill, manufacture, design, stain, and finish, we have the ability to do it right here in this office. So I have a very long time patient, Mrs. White, I've known for over a decade. We've placed upper and lower all-on-4 implants, 4 on the top, 5 on the bottom. The implants that we placed 10 years ago are in great shape. The abutments are really nice and healed. But over a period of time, the teeth were chipping, teeth were breaking. So we wanted to see what we could do better. So now, as Mrs. White came in for a regular checkup and cleanings, we talked to her about the Zircon-Zahn technology, which was the zirconia teeth. So now we are in the process of taking her hybrid teeth that were made out of high impact acrylic, and now we're going to be making the new beautiful zirconia teeth. What's going to happen is that these teeth are going to be more aesthetic, they're going to be more stronger, and they're going to be a lot more durable, which is really important for her because she can eat, she can chew, and not worry. You met me last year. What was your problem with your teeth?
Well, my problem was I had gum disease and tooth decay.
Right.
And my teeth started falling when I was around 17, 18 years old.
You had the full upper all-on-4 implants, all-on-5 implants done.
Yeah,
And smile for us. These are your beautiful zirconia teeth that we made in our in-house milling with the Zircon-Zahn.
Well, my experience was actually really wonderful. I mean, it was long, but it was really worthwhile. Honestly, the best decision I ever made in my life. Honestly. I've never felt so beautiful and like confident finally after so many years.